What treatments do you have for men?
Ah,
I would like to look more masculine for summer.
Because I think your hand was a dog. So you're not an actual dog. Okay. What treatments do we have for men?
So many.
My gosh. You're saying you want to look more masculine. So the first thing I'd say is, what is it about you that makes you feel you don't look masculine or makes you look more feminine? I mean, that's just a really tough question to answer. It's kind of very much like you go to a party as a plastic surgeon. Hey, I still go to parties, don't you know, even though I'm nearly 50. You just go out and people meet you and they hear you're a plastic surgeon. They say, what would you do for me? And I say, I would do nothing because you haven't asked me to do anything. And I would do the thing that concerns you. If you tell me you have a thing that concerns you, A, and B, that thing actually exists, and C, I'm able to deal with it. Those are the three things that I have to meet. So
yeah, but it's not your job to say to people, you need to address this.
No one needs
exactly
to do anything.
You just never do that.
I'm in the business of making people feel emotionally confident about their body and comfortable and able to do the functional activities they want to do and so on. So if you're already ticking all those boxes, there's not a thing to do with you. You're already perfect. But if you are really self-conscious about your tummy, and I look at your tummy and I think, okay, I get why you're really self-conscious about that and I can help that, then I'm all over that. But your identical twin who has exactly the same tummy but is thinking, you know what, I don't give a monkeys about that, I'm going to do whatever I want to do and I'm really happy, then I would not do anything for them, despite the physicalness between the two of you being identical. So, you're going to need to guide me along with what can I do to make you look more masculine.
So
I don't know.
replied and they said flabby tummy.
Okay.
And I've seen ab treatments.
Okay, so flabby tummy. Right, I'm going to ask you to go back to my through the grid, and there's a patient there who is an inspiration to all of us. He lost 55 kilos during lockdown. 55. Talk about flabby tummy. He had big tummy, lost 55 kilos, and had flabby skin. Then, so in his case, I ended up doing a circumferential tummy tuck. So circumferential tummy tuck, no liposuction. He'd done it all himself. No lipo, some contouring with stitches.
He worked hard.
He worked really hard. And for his chest, he had gynecomastia, unhappily called man boobs, but gynecomastia. And for that, I did do liposuction. I made a little scar around his nipple to take out the breast tissue underneath. I used Renuvion to sort of shrink wrap the skin back down. And then I did these things called Auerswald stitches. Don't you know I can say things like that? Auerswald stitches.
I know, I quoted it today.
Did you?
Yeah, another surgeon came in and they were talking about it on the face. And I said, that's
an Auerswald net, right. I did that. Get you? And I did that to his chest. And I tell you, if you look through the grid and you find this guy, you'll know who he is immediately. And he just looks incredible, to the point that I was walking with him down the corridor in a hospital at one point during one of our meetings, and a younger nurse walked past him and she got kind of giddy and said to me, caught me afterwards and said, that person you were with, are they a model? Are they famous? And that's my lovely patient, who is very handsome.
He's
very handsome and just looks beautiful.
And he's a lovely
lovely guy as well. But it takes people mentally quite a while to catch up with their new appearance and the attention they get sometimes. It's really interesting that. So he's still the overweight guy who no one would look at. So you actually find these incredible looking people who are also the loveliest people who don't really know what effect they're having on people. So interesting.